Hey YouTube, this is Dr. Ray, family nurse practitioner, and this is,
I'm Dr. Marita P., and I am a nurse educator. OBGYN, well baby nursery is my specialty.
and we are both doctorally prepared nurses here to educate and elevate the scope of nursing. So in today's topic, we're going to talk about some of our personal struggles through undergraduate nursing school. So I'll get the ball rolling. I'm just going to talk about a few because the video would be too long if I named all of them. So first things first, my mindset. I became mentally stronger in nursing school than I probably ever have in any other aspect of my life. Or should I say, most other aspects of my life. I had to develop a, by any means necessary mindset for nursing school. The nursing school I went to, it was actually an excellent program. At the time, I don't want to date myself, but let's just say it was more than a decade ago. It was one of the top 10 nursing schools in the United States. I'm not sure where they rank now, but it's an excellent nursing school. It was an excellent program that I attended. That said, it was a PWI institution, a predominantly white institution. And as you can see, I am a person of color. So there was some overt racism there. However, in addition to that, I will say I earned an excellent education there. And that did not come without a cost. And I don't mean cost as in price, as in how much the tuition is. I mean cost as in what you have to endure in order to get through the program. And some of those things, not limited to enduring racism, also enduring feeling less than at times, feeling like I wasn't smart enough at times. Going into nursing school, I had a 4.0 GPA. And coming out of nursing school, that was not the case. It was 3 point something rather. It was definitely not a 4.0. I was humbled when I got to nursing school. Nursing school has a way of shaping your mind. So because of the way you have to critically think and the way you have to think in order to answer NCLEX style questions, there's going to be a paradigm shift. And with that also came some other transformations within myself. To the number one lesson for me was to not give up on myself, because I quit every day. Every day I quit. It's a wonder I'm even still here, because every day I quit nursing school. But I was able to push through it. And despite all of my setbacks, my failures, my late nights, my early mornings, sleep deprivation, I was able to make it through. And so can you.
So nursing school for me, I went to a PWI as well, and we only took in 80 students per year. And out of all 80, I want to say only 7 of us were ethnic minorities, different places that we come from, but 7 were ethnic minorities. By the end of week 1 of nursing school, we had already lost a total of 10 students total, no matter the race, 10. So we were down to 70 at the beginning of week 1. And that's how crazy nursing school was for us. And I think of those 10, probably 2 of those were minorities. We didn't have what you call overt racism, where it's in your face, it's deliberate, it's, they're purposely doing this to you. It was more of the covert nature. And I don't think because I grew up in a military town, the school is in a military town, that I realized racism for what it was. I thought it was just the cliquishness of what nursing school can be like. And the same with my prereqs, because I already have a degree in psychology before I came to nursing school. So the college life for me, I had already become acclimated to. It was just more so, how is this different than normal college life? Well, for one, it's mostly women, okay, and mostly white women. And that in itself doesn't bother me, because mostly women go to school in general, and education wise, mostly white at that time period, So I'm going to date myself. This is back in 2002. I've been a nurse for 18 years. So this may not be a current trend, but this is definitely how it was back then, that white women, what are you going to see in school anyway? Now Black women are the top degree holders, but that wasn't the case during that time period. But anyway, it would just be situations where the white students would go and they would be privy to information for somehow, some way, and we wouldn't get it. So our classes were all over campus because we didn't have enough auditorium space for 70 students in one classroom. So now when we start trickling down, so we got down to like 40 and 50 students because people, dropped or whatever, then we actually had classroom space. We didn't have any. And I would notice that they would do things like they would know for whatever reason, oh, this is due this day, this is due that day. And I'm like, well, how did y'all get an extension? And we knew nothing about the extension or whatever. We found out that they were doing things like that, which made it hard on us. All our instructors were white except for one, and she left when we graduated in 2004. She quit, and at that point in time, I realized why representation matters, not only in nursing school from the student perspective, but from the faculty perspective as well. Imagine going to school where there's only 2 or 3 of you who look like you, ethnic minorities, and then there's one instructor who looks like you. I never realized until now, as an educator myself, the importance of representation. I'm like, okay, well, white instructor, black instructor, what's the difference? I see the difference. I see the difference. Everybody does not have your best interest at heart, and everybody's not going to know your personal struggles. And there's struggles that minorities go through in nursing school, a lot of gatekeeping that goes on that I didn't realize that happened back then. So for me, that was one of my struggles, is just the reality of what nursing school looks like. Now, as a some background, some context, I'm first generation. So going to college in itself was a big thing because of the fact that my mother and father did not even have a high school diploma. So coming back to this space of going to school for not only for my first degree, but my second degree at that point in time. And I was only, want to say, 24 years old when I was getting my second degree with 2 children. So with that being said, it was a situation where I just don't think I realized what I was getting myself into, with the covert racial issues, the cliquishness of the students, and the lack of diversity. I think that's a big struggle of mine.
Absolutely, I agree. And I'm also first generation college grad for my family. So going to college was a big deal when I went within my family. And they watched me struggle through it. They were very supportive though. The next big struggle, I will say for me, was the hardest class for me, I'll say, for me was pharmacology. I swear that class sent me to an early grave. I'm telling if I was supposed to live to be 90, I'm 88 now. It has taken years off my life. Pharmacology for me was the hardest class. Pharmacology, in my opinion, was harder in undergrad than it was for when I went as a nurse practitioner, simply because by the time I had several years of experience as a nurse before I went to school to be a nurse practitioner. So I already had some pharmacology knowledge, whereas going into undergrad, prior to being a nurse, I was a paramedic. So I knew a handful of emergency medications, but that was it. So I was pretty fresh in terms of knowing the different medications, the pharmacokinetics, et cetera, drug interactions, et cetera. And it was just very challenging. The particular school I went to, you didn't get a lot of chances either. You had 2 exams. You had a midterm and a final. They were both were 40%. If you fail your midterm, just don't even come back. And then you had 2 quizzes, 10% each. And that's it. There were no papers, there were no presentations, and extra credit. No, but they didn't do none of that then. I went to a real school. So, so you had to put in work. It wasn't no extra credit, was no can I retake, wasn't no redos. You knew not to even ask for that. You know that it's you do it or you don't. You perform or you don't. And that was the attitude there. It was a very resourceful school. We had a lot of resources, but you had to perform, and that was just the end of it. Another thing that taught me was to be very resourceful. So I knew that if I, with pharmacology, for instance, when I struggled and I knew to reach out and get help from tutors. I went and got additional study resources, things that just weren't necessarily on the syllabus, but I knew I was having trouble with these things. So I know that I had to put extra effort into being able to learn and master what I needed to in order to get through the course. So it definitely taught me to be more resourceful. It taught me to be able to self-analyze myself, to understand, well, what is it that I need in order to get this result? versus waiting for someone to tell me what to do to get a certain result. Because sometimes you can tell people what you did to get a certain result, but sometimes that might need to be tweaked depending on your specific circumstance. So it taught me to be resourceful and self-reflective as well.
So for me, my struggle in terms of school, in terms of actual content, I didn't have a hard time. I came in with a 3.0 from my other degree, and then I actually graduated with 3.0. So I didn't get any worse, but I didn't get any better. But the thing is, the point is graduate. A B, 3.0 is a B. So B is not bad, especially in nursing school, is not bad. And the one thing that I would tell people all the time, an A in your general ed classes is like, well, A in your general ed classes, or let me go back the other way. A C in nursing school is like an A in general ed classes. That's how hard it is. So for me to come out with a 3.0 GPA in nursing school is like getting, what's the highest cum laude in the regular world?
Magnum or Sigma,
Whatever,
one of them.
somebody's cum laude, whatever cum laude it happens to be. That's what the equivalent would have been, because a 3.0 in nursing school, a B in nursing school is like an A in your general ed classes, because nursing school is just that hard. And if you're getting a bachelor's degree, it's one of the most hardest degrees to obtain. We take, more tests than the average program does. Not knocking any other program, but that's just the nature of a BSN program. And I got a BSN. You got a BSN as well?
Yes.
And so, but for me, class-wise, theory-wise, we had, the funny thing is, the one class that liked to take me out, I do not like med surge. I didn't like pharmacology, didn't like any of my classes, but OB was the class I was looking forward to. I was so excited about OB. And, get to the class because I knew I wanted to be a mother, baby nurse or whatever. I wanted to do OB. And that class like it took me out. And that class almost takes a lot of people out. That and peds will almost take everybody out. And part of the reason why it does that is because of the fact that it is so against the grain from everything you've been taught thus far. Most programs do your specialty classes towards the end. So you do your med surge. Med surge is a specialty in itself, but still med surge is what you get into first. And then you get into your ER rotations, your OB, your community health, mental health, peds, all that later type of thing. Most programs do. So we took our OB class in our senior year, and our class was split. So half of us went to, because I told you it was a huge class, it was down to 70 something by this point, maybe even down to 60 something by now, because it's a year later, right? And we had, so 30 of us went to med surge, the other 30 people went to OB peds, and then we would flip the next semester. So my first semester of senior year, I went to OB peds. And by test one, and this is how hard our nursing program was, you didn't go to clinical unless you were passing going into each clinical day. So if I think the passing was 76 back then. So let's just say, for instance, you took a test today and you bombed it. You got a 70. Well, clinical's tomorrow, right? As an example. You don't go to clinical tomorrow.
Mm-hmm.
So then you have to wait till the next test to get your grade up, right? Well, we didn't have tests weekly. So it's probably gonna be another 2 weeks before we had another test. But guess what? I had another clinical day since then, because we go to clinical every week. So I missed 2 clinical days. 2 clinical days after that, you're out the class that you've missed, because you have to make those days up. Because I still had a 70 or whatever the grade was I had, and hadn't had another test yet. So we couldn't go to clinical until you had, a 76 average or above going into every single test. And so it ended up that, so then the next week I had a test, right? I got that grade, whatever I got it up. So then I got to go to clinical from that point on, but then I also had to make up those 2 clinical days. That's why I almost failed. Not because of the fact that I was just a bad student or whatever. It was because of the fact that I did fail that first test. And that first test was over labor delivery content. Well, it was so bad in our class that the instructor got fired because half the class had failed at that point. And so now we were a class of 30 down to a class of 15. And so because half the class, you had to drop, they withdrew, failed, whatever you want to call it, they were gone mid-semester. And I finished it. I finished that class with a B. And how those tables turn is I teach OB as we speak. That is my specialty, and I love it. But that was a struggle I had in terms of like, wow, why is this stuff so hard? But in hindsight, I get now why it's so hard because we're talking about taking care of people. In this case, we're talking about taking care of moms and babies. And in this part of labor and delivery, keep in mind the baby is inside the mom until it's delivered. It's inside the mom. So you're taking care of two people in one. And I just wasn't getting the components of L&D at that point in time, but I do now. So that's another one of my struggles that I had was just the OB class. Everything else, farm I didn't like, but did well in it. Every class I had, again, I had a 3.0, so I made mostly Bs. I made one C in nursing school, and that was in adult health 2, or med surg, whatever y'all call it, med surg 2, whatever y'all call it. And you had to get an 85 to be in a class. I got an 84 in that class because cardiac, that chapter, it took me out. It took me out. And so, and to this day, cardiac is my weakest system. I get the fundamentals of how the heart works. It goes in and out, the blood goes. But like there's some things I'm like, okay, I don't remember that. But I know enough to take care of my patients, my point is. But I'm just saying, so yes, I had struggles even academically in nursing school, but it wasn't too severe. Yeah, it wasn't that bad.
Totally agree. And cardiac, even as I teach, I find that is the body system that most of my students tend to struggle with. It is challenging. And one of my other struggles I'll talk about is learning to answer NCLEX style questions. And I say that because the type of questioning that you have to do and reason through is not like the type of questions you did in your prerequisites. So it's primarily application and it's thinking in a way that they call critical thinking, and it's not intuitive. This is something you must practice. No one is going to be born understanding how to answer these types of questions. So understanding how to change my way of thinking in order to adapt to that was definitely a challenge. And as you can imagine, my hardest class to do that, and of course with pharmacology, that I proudly earned a C in. It was the hardest earned C ever. And that's where I say I got my battle scars from. But learn to answer those NCLEX style questions, thinking through, always understanding that everything you do in nursing, you must have a rationale. Even if it's something as small as taking a temperature. Why are you taking a temperature? Do you think your patient is febrile? Is it just time to take vitals? Are you doing an intake? What is your rationale for everything you do for your patient? And understanding the rationale behind things, and also understanding the effects that your care has on that patient. So kind of bundling all those ideas together to apply those to NCLEX style questions, because the ultimate goal of nursing school is to pass your board exam so that you can become a nurse. And with that, you have to get through those NCLEX style questions. And it's not easy. It will have to change your way of thinking. It's not something where you just say, today is, and it's just list Monday through Sunday, you just pick the day. No, it's not like that. And actually, you don't want anyone taking care of you that's the highest level in which they're able to think. So you have to be able to assess and put things together as a nurse. And these questions kind of get the wheels turning in your brain to think critically and to look at the big picture and how the big picture can affect your patient.
That's a good point. I think my last struggle, and there's many struggles, like we said, but I'm going to only name 3 today. So my last struggle that I want to talk about was clinical. In your undergrad, in your general ed courses, there's typically not a practical, more clinical, or nothing like that. You learn the material. The War of 1812 is the War of 1812. Ain't much you can do with that. You see what I'm saying? You can do a reenactment in class. You can do active learning activities, but clinical is just a different component than it is when it comes to anything else that you can think of. And I don't think I understood the application process. Like, I'm going to take what I learned in theory, didactic, and apply it to the real world. So they didn't do a good job. I mean, I went to a great program, but I don't think I made the connection. And in addition to that, I went to school. I went to school from 2002 to 2004 in terms of the nursing school years. Because I already had a bachelor's degree, all those hours just transferred over. So I only had to do those 2 years of the BSN component, of the nursing school component. And, you know, I came out of school, I was in school during a time period where there's a lot of transition and change going on. So I came to school when they were just introducing computerized charting. So I learned how to do the narrative notes, the progress notes, to write them out, as well as to do computer charting at the same time. That was very hard to do. Um, because you learn one way and then you're trying to find the button somewhere else. You see what I'm saying? So like, okay, when classroom we learn, and then we would go to nursing homes, skilled learning facilities, or skilled nursing facilities or whatever, and they would all have the narrative, the notes. You had to write it out. And then you go to a hospital who just had introduced the computer, and I'm like, where do we find this at? Where do we find that at? And then we got delegated just to do vital signs. Um, I think that was a struggle too, trying to learn this, that, and the other, how the healthcare system works. They did not do the best job, I will say, in terms of didactic theory. Hands down, I knew what I needed to know. But in the clinical setting, some of our instructors or educators were not the best. The clinical instructors were not the best in terms of making sure that, okay, what you learned in class is how this works in the real world, how to bridge those two things together. So I just found myself going around doing what I call mundane tasks. Like, okay, go get your set of vital signs. All right, let me go get them. Here you go, write them down, whatever. No one took the time to say, this is how you think like a nurse. This is how you put your entire day together as a nurse. So, and this still happens today, to be honest with you. I see that's just why I do my clinicals different, because I do it based off of what I need, what I felt like I needed, not what the normal trend is. So you go to this one clinical, and the only thing you're allowed to do is vital signs, and that is it. Then you go to another clinical, only thing you're doing over there is giving bed baths all day. Then you go to another clinical, oh, you can pass 2 meds today. Now you done spend 8 to 12 hours in clinicals all day long, that's all you done did. Did you every 3 or 4 hour vital signs, you done gave them a bath, you done put the water pitcher up, whatever. But no one took the time to say, hey, let me help you mentally put together what your day is like as a nurse. So we may not make it to report, or we didn't get the whole picture, or we did get report. But the thing is, sometimes the nurses were so bad and shady that they wouldn't, it was kind of like, when you turn the lights on and the roaches be going everywhere. When we show up to the floor, when the nursing students show up to the floor, now we were all white back then, all whites. When we show up to the floor, them nurses scattered like roaches when you turn the light on. So they wasn't helpful either. And so our instructor got left with the task of trying to put the whole thing together. So we didn't have the best clinical experiences for the most part. And I had to come back with a story time for mental health, because that was traumatizing, and that has some traumas that still linger today in terms of what we're taught in nursing school, and then the reality when you get out here about therapeutic communication and on and on. I won't get into that today, but that was a big one for me, that the application of what you learned in nursing school didn't always correlate with what the real world was doing. They were teaching one thing, we go to the facility and they're like, okay, well, go get the medication. Like, out of what? Well, we didn't have Pyxis back then, or Omnicills back then, or Acudose, whatever you call your medication receptacle. We had drawers still, patient or carts. Are they called drawers or carts? I don't know what they're called anymore.
Carts.
Carts, yeah. So you had a big old cart and you had room numbers on it, and it's supposed to be locked, but half the time it wasn't. So you go pull out whoever's medication you needed, and you had a whole big old baggie, Ziploc plastic bag with all their 50,000 meds in it that you had to sort through. Now, mind you, we ain't halfway did pharmacology, so we don't know what the name, that the trade name is. We don't know what the generic name is. We don't know nothing.
Gosh, I know.
And we up here jumping out the patient's beds on the little cart, trying to sift through. Y'all see, like puzzle pieces. You're trying to find puzzle pieces. That's what we're trying to do with these medications. And mind you, we got now the real nurses behind us. Y'all need to, get this together. It was a disaster. No one prepped us for clinical. It's just like, okay, now go do this, now go do that. So putting the whole thing together, we had difficulty with. So that's kind of like my biggest, I guess the biggest thing that didn't work out for me. The classes I got through, we had little hiccups here and there, but them clinicals was, it was no count. It was no count.
Okay, if you've made it this far in the video, Thank you. We'll be back with subsequent videos talking about some nursing school traumas and how to overcome them. I think nursing school gives a lot of people some level of mental trauma, unfortunately, as well as nursing. And we will have some additional content for nurses coming up in the future. And take us home, Dr. Pace.
All right, so thank you again for watching this channel. Please subscribe, like, comment, share, push this out here. We really want to get to as many people as we can with this content. This content is coming from two doctorally prepared nurses who, again, we have the highest degree in nursing that you can get, and we want to share what we know with you. And if you don't mind, please also follow us on our other social media platforms, which you can find in the banner at the very top. In addition to that, we will have it in the description box below, where you can find us at Nursing Dynamics on TikTok, as well as at Nursing Dynamics on Instagram. In addition to that, you will see in the banner, there's an Amazon icon. Click that icon and go to our storefront, where you can find the things in which we have vetted and decide these are the best products we like for various things. So if you're into nursing, okay, we have a section called Nursing Essentials. You will find A&P study guides, materials, cheat sheets, NCLEX books. There's a new NCLEX coming out, y'all. So if y'all don't know, 2023, if you see this now in June of 2022 or the future, there is a new NCLEX coming out, or by the time you see this, it can be already out. Anyway, there's a book by Dr. Iggy, Dr. Donna Iggy, Ignatius or something like that is her name. That's in there too, to help you with critical thinking and clinical judgment. So you won't have some of the same problems that we had when we were coming through school. So there's NCLEX books in there that we recommend. We have vetted. These are good books that we recommend. You can go through that storefront and purchase your books that way. Also, people have asked about skincare. What do we do for our skincare? We have some skincare ideas or things that we use on a daily basis to get the skin we have. We want makeup optional skin, so I don't want to have to wear makeup if I don't want to. Skincare, good skincare is your foundation, is a good canvas for that. You'll find that in the storefront as well as many other things, other categories of items that we have that you may enjoy. Again, follow, comment, share, and until the next time, you all take care. We'll see you in the next video. Bye-bye.